Bismillahirrahmanirrahim. So today we are going to study about the Warthin tumor. So we have already discussed that the salivary gland tumors are classified into two types, the benign and the malignant. The benign tumor consists of two important, the pleomorphic adenoma, and the second most important one is the Warthin tumor. Warthin tumor. So today we are going to study about this Warthin tumor. So Warthin tumor is also known as papillary cyst adenoma lymphomatosum. Remember this name because this will help you in the memorization of the morphology of this Warthin tumor. Papillary cyst adenoma lymphomatosum. Now let's talk about the Warthin tumor. So it is the second most common benign tumor. Benign tumor of the salivary gland. It frequently occurs bilaterally. It is most common in the smokers. This is the most important point. It is the most common in the smoker and in the middle-aged and older men. It mostly occurs in the age of about 60 to 70 years of age and has a slightly male predominance. It has a male predominance. And in contrast to the pleomorphic adenoma, it almost always arises in the parotid gland. In the parotid gland. Now, let's talk about the pathogenesis of the pleomorphic adenoma. So, the exact pathogenesis is unknown, how does this Warthin tumor develops, but it is said that it is due to the neoplastic proliferations of the salivary gland ductal epithelium, which has been entrapped in the intra or the parotid nodes during the embryonic development. It is the neoplastic proliferations of the salivary gland ductal epithelium entrapped in the intra or the paraparotid lymph nodes during the embryonic development. And now what causes the neoplasia? So as I have already discussed that smokers are most commonly involved, so the smoking can cause irritation of this salivary gland ductal epithelium, which in turn can lead to the neoplastic proliferations in the Warthin tumor. Now let's talk about the morphology of the Warthin tumor. So grossly they can be seen as encapsulated round to oval with a smooth surface. In a cut surface we can see cystic spaces containing motor oil like fluid. I have already said that. Remember this second name of the Warthin tumor, which is papillary cyst adenoma lymphomatosum. This is the second name, cyst adenoma. Papillary cyst adenoma lymphomatosum. So on the cut surface section we can see it consists of cystic spaces. So it consists of cyst adenoma cystic spaces. Histologically we can see two components in this Warthin tumor. The first component is the epithelial parenchyma, which is composed of cystic structures. Of the glands having a papillary projections into it. For example, if this is the gland, it consists of cystic structures having papillary projections into these cystic spaces. In these papillary projections, the cystic spaces are lined by a characteristic double layer of epithelium. This basal is the cuboidal and the luminal is the tall columnar, which is also known as oncocytic epithelium. And the second component, so here in this name we can see papillary. So papillary projects into the cystic spaces of the glands, adenoma of the glands, and the second one is the lymphomatosum, which is the second component of the Warthin tumor. It consists of lymphoid stroma in the form of prominent lymphoid tissues having a germinal centers. These can be seen in this diagram as these are the cystic spaces. All these are the cystic spaces having a papillary projections into it. These are all papillary projections. Here you can see papillary projections into the cystic spaces, and these cystic spaces are lined by a double layer of epithelium, as I have already said, a cuboidal epithelium, a basal cuboidal, and a luminal columnar epithelium. And these are the lymphoid tissues consisting of the germinal center. These are the lymphoid tissues having a germinal centers. Now here you can see the cystic spaces having papillary projections, and here you can see the double layer epithelium. This is basal and this is luminal columnar epithelium. This is basal cuboidal and this is luminal columnar. Here you can see the germinal center, and these all is the lymphoid tissue. So that's all for today. Thank you.